number 7, oral pathology. So types of oral lesions. The first ones we will discuss are lesions that extend below the surface. Number 1 is the ulcer. It's a defect that varies greatly in size and presents as a break in the continuity of the mucosa, similar to a crater. Often these ulcers can be painful. Erosion are a shallow defect in the soft tissue caused often by mechanical trauma. The margins are usually irregular, red, and painful also. An abscess is something as a dental assistant you will see, and it is a localized collection of pus in a circumscribed area, often around the end of a root of a tooth. A cyst is an epithelial lined sac that is filled with fluid or a semi-solid material. There are also lesions that extend above the surface, and that would be a blister, which is a sharply circumscribed lesion filled with a watery fluid. A pustule, which is similar to a blister but contains only pus. A hematoma, which is similar to a blister but contains only blood. And a plaque, which is a flat area raised slightly from the surrounding tissues. Dental caries are another form of oral pathology, and that is a disease caused by bacteria and their byproducts found in dental plaque. This bacteria causes the dental caries is Strep mutans and Lactobacillus. Dental caries is known as decay, and this is the destructive process that includes and involves the hard tissues of the teeth and the exposed areas in the oral cavity. How to control of caries is by reducing the number of bacteria through plaque removal, brushing your teeth, and increasing your host resistance by strengthening teeth with fluoride and decreasing sugar in the diet. There are different stages of how this dental caries or cavity progresses in a tooth. Stage 1 is a smooth surface caries, a triangular shaped decay that usually occurs between the teeth below that contact point where the teeth come together. The broad area of decay takes place on the surface of the enamel and is the base of the triangle, and the point of the triangle is pointed towards the dentino-enamel junction, or DEJ. When the decay hits the DEJ, it then expands laterally. Stage 2, the dental decay triangle, is still confined to that enamel structure, similar to stage 1, but has passed through the halfway point of the outer surface of that tooth. The fillings performed at this stage may remain within enamel or extend just slightly into the dentin. At stage 3, this stage, the decay triangle has passed through the DEJ and into the dentin middle part of the tooth. The decay has not passed the halfway point between the DEJ and the pulp. This decay must be removed and a restoration must be placed. Stage 4, as in stage 3, the decay triangle has passed through the DEJ, past halfway point between the DEJ and the pulp, and fillings at this point are usually quite large, and if left untreated, the decay will penetrate and reach the pulp tissue. Once decay reaches the pulp tissue, a restoration is no longer sufficient, and a root canal is often required at this time. A root canal, besides stage 4 caries, trauma can also lead to a root canal. So during a root canal procedure, the dental pulp is removed from the inside of the tooth, and that vacant area is now filled with a permanent restoration. Root canals will be covered, further detailed in the endodontic lecture portion. Damage of the oral soft tissues. There are damage that can occur to oral soft tissues, including aphthous ulcers, which are also known as canker sores, and they're a form of an oral mucosa ulceration. Recurrent aphthous ulcers is a disease that causes reoccurring outbreaks of blister-like sores inside the mouth and lips. These sores make it incredibly difficult to eat and drink. Topical agents are usually suggested for pain control. Bruxism is another damage to oral soft tissues, and it's a habit that consists of involuntary grinding and clenching of the teeth in movements other than chewing. They usually occur during sleep and are commonly associated with stress. This condition can lead to abnormal wear of the teeth and damage of the supporting structures, as well as damage to the TMJ joints. Oral cancer, 1 in 10, is caused by oral cancer around the world. Most of these types of cancers do not cause pain, and usually the dentist is the first one to detect it. Smokeless tobacco can also cause damage to oral soft tissues. Chewing tobacco is a serious health risk. Among its users is a high rate of precancerous cells and oral cancer. Cancers of the pharynx, larynx, and esophagus are 400 to 500 times more frequent in users of smokeless tobacco than non. Also associated with smokeless tobacco is premature tooth loss, elevated blood pressure, heart disease, and gastric ulcers.